The production of this program is made possible thanks to the support of the following and viewers like you. Your thoughts and feelings could impact hormones and the immune and nervous systems was Dr. Linda Carlson's thesis. Her goal was to confirm that mindfulness could impact and improve cancer care. She says some doctors thought that was all hocus-pocus or new-agey. Carlson already was a well-respected and rigorous researcher, and she says, "My approach was to conduct a disciplined scientific study that would produce evidence-based therapies." In 2018, Carlson realized her goal and launched the Tom Baker Cancer Center at the University of Calgary, known as the Action Center or the Alberta Complementary Therapy and Integrative Oncology Center, the first of its kind in Canada. Using patient-centered, evidence-based therapies, Carlson said, "We use mind and body practices along with natural products coupled with lifestyle modifications in conjunction with conventional cancer care treatments." I invited Dr. Linda Carlson, a 2023 Dr. Rogers Prize co-winner, to join me for a conversation that matters about mindful cancer care. Dr. Carlson, thank you for joining me.
That's my pleasure.
You know, mindfulness is really something that is quite extraordinary. And there's been a real, I sense a movement towards it, partly because I think people are trying to find some kind of inner peace, hoping that that's going to bring about a better life. But that's really only touching the surface of it, isn't it? Especially when you think about mindfulness and you wanted to describe what the benefit to somebody. How would you describe that?
Sure. Well, I would start with the definition of mindfulness, which is paying attention in the present moment with a non-judgmental, kind, curious, accepting attitude. And I would also distinguish that way of being. So mindfulness is a way of being in the world. It doesn't take extra time to pay attention, to be mindful. But it's also a practice that we do of mindfulness meditation to cultivate that capacity. And why do we need to cultivate the capacity? Because if you look at where your mind is, and I often ask people this question, how often do you think you're paying attention to what you're actually doing? People will usually laugh and say, well, probably not very often. And that's because our minds tend to either be in the past, right? Where we're thinking about, oh, I coulda, shoulda, woulda done this. Or if it's someone dealing with illness, well, why me? If only I'd done this, or if only that. Or maybe they're feeling angry or self-blame or having regret. And that leads to these feelings of sadness. And you can't change the past. So when you're spending a lot of time thinking about it, it just really digs you into that hole of depression. Or many of us, our minds are racing off to the future. Right? For people with cancer, they're worrying about, what's going to happen? What if this? How am I going to get through it? And even just everyday people, I've got so much to do, and just feeling stressed and really anxious. And so our mind's there, it's there, but it's rarely in the present moment. And it turns out that if we can learn to be paying attention with acceptance to everything that's happening in the present moment, people actually report feeling a lot happier, because that falls away. This sort of ruminating on stuff we can't change and predicting the future that may never happen. We can engage fully in the present moment with whatever we're undertaking.
Do you think that part of that focused on the past, focused on the future, or focused on something else? I mean, we're overstimulated.
Yeah. And so we might be judging or planning
or just exploring things that separate ourselves from ourselves, like how important is it that our relationship with self, and how does mindfulness help us to get to that place where we're at peace with who we are? Or maybe that's one of the objectives.
That's really the heart of the practice, is paying attention to exactly what's happening with our thoughts, with our feelings, with our bodies, moment to moment, and being okay with it.
I noticed that you have used the term being non-judgmental.
Yeah.
How difficult is it to embrace that concept? Because there's so many things that push on us in our modern life to say, well, no, you should judge this, or you should judge that.
Yeah, or I like this, I don't like that, right? And so the first step to moving back from judgment is to become aware of it. And I always say this to people, pay attention to your thoughts and just notice how many of them are judging yourself or others, or I like this, I don't like that, why are we doing this, I wish this, and then notice how those thoughts cause you to feel, because they cause suffering. And people can see that in real time when they begin to pay attention to the way that their mind is working. And so letting go, or even just loosening our hold on those judgments, again, people can observe in real time how that affects their experience.
You embrace mindfulness, not from the idea that, okay, I just want you to go home and live in the moment and be at peace with yourself, but as a way of dealing with the most horrific diseases that I can think of in our modern world, like cancer. How did you go from saying, okay, mindfulness practices have real world and powerful implications for somebody who is now dealing with cancer?
Well, because recognizing that some of the really profound value of a mindfulness practice is in dealing with things we can't control and uncertainties around the future, but also concrete tools to respond better to stressors in our life and to manage symptoms that are quite common in people with cancer, things like fatigue and sleeplessness and pain. And it just turns out that the mindfulness approach from different angles gets at all of these things, which are core features of what makes living with cancer and dying from cancer so difficult.
There's fear in there too.
Absolutely. There's fear of recurrence, there's fear of the unknown. So can we feel fear? That's okay. What is it like to be fearful? How does it feel in the body? What happens if you breathe into those areas? And so familiarizing ourselves with this territory that sometimes we try to push away, push aside or suppress, and I don't want to go there, I don't want to think about dying. You know what? Thinking about it doesn't make it any more likely to happen. It actually gives a sense of relief for people to confront their deepest fears, because we're all going to die sometime, but we live our lives as if that's not true. And it's paradoxical, because really the most profound way to wake up and live your life in a truly engaged way is to recognize that it's time limited and you can be done with your life at any time. And so recognizing that, okay, this cancer diagnosis means that I might not have as much time as maybe I thought I would. So what am I going to do with that time? Right? The time that I have, do I want to sleepwalk through it? Do I want to work more? How do I want to build a sense of meaning and purpose in my life, no matter how much time I have, knowing that for all of us, it's time limited.
The production of this program is made possible thanks to the support of the following and viewers like you. At the beginning of your program, you touched on what you call IAA, intention, awareness, acceptance. Let's go through each of those. So why is intention so important? If you're going to take the practice of mindfulness and direct it towards your journey with cancer.
Sure, yeah. So the three components are intention, attention, and attitude, IAA.
I got it wrong. Okay.
Oh, it was close.
Yeah.
It was you actually got the heart of it, just not the exact words. So intention is kind of the why. Why would we practice mindfulness, right? Attention is what we practice, and then attitude is how we practice. So the why is really what keeps you motivated to do this practice on a regular basis. And the intention for people with cancer may shift over the course of their disease journey or trajectory. At the beginning, often people come to us and they're just like, I'm so in my head and I'm so scared and I just need to calm down. I have to get through these treatments. I've got pain. I can't sleep. And so we can really focus in on those things. But as time goes by, these more existential questions often come up. Is that, this cancer has given me the opportunity to maybe slow down. Maybe I'm off work. I've got a bit more time to think about, is this how I want to live the rest of my life? And maybe it is, and maybe there's changes we'd like to make. And so the practice gives you this space when you do the formal practice to slow down and to look at what is coming up in your thoughts and what's your body telling you, what are your emotions telling you, and do you need to make changes, and what might that look like? And then as we progress even further in practice, there's more of a spiritual element, perhaps, a sense of connection with something larger than yourself. This sort of shifting from dualistic way of seeing the world to like self and other to a non-dualistic way where there is no distinction between subject and object. And really, it's a cliche, but we are all kind of one, right? And so people may come to that eventually.
So you also talk about intention at the beginning of treatment, or well, actually the realization that you have cancer. I know that in one of the papers that you published, you go, okay, there's something that feels awkward about my body. So I have to go to the doctor and they run some tests. They call me back in. And then when you hear those words, you have cancer, you don't hear anything else, because then your mind just goes blank. Where does mindfulness and directing your attention help you get through the shock of it? Because I think that's probably one of the hardest elements going on in someone's mind when they say, I have cancer.
Absolutely. And it's very true that people are overwhelmed and they don't hear another word the doctor says after hearing the diagnosis. And so mindfulness is not about denying our experience. In fact, it's the opposite. So it's not denying, it's not distracting, it's actually the opposite. It's facing our difficult emotions in a container that's kind and compassionate. And it gives you the opportunity to explore those feelings. And by watching them and exploring them, to actually move through them in a way. And so it's very helpful for people to just be able to slow down at that time when their thoughts are going wild. And, we talked about all those fears of the future, and maybe they're saying, well, oh, it's all my fault that I got cancer, and they're feeling terrible, so just to sit down quietly on a regular basis and allow that self-compassion to arise and to really understand what one's going through and not just be driven by these emotions kind of unconsciously.
You just said something there that I think some people will go, oh, this is my fault. And that's not the intention here.
Oh, absolutely not. Yeah, I mean, even the cancer biologists don't fully understand what causes cancer. And there's certain things that can increase your risk, like your genetic predisposition or your environmental exposures. One thing that may increase risk is also exposure to lots of stressful life events. You can't know what contribution that had towards your cancer, but we certainly do know that once you've been diagnosed, there's many different things you can do to change the way you respond in the future in a way that's a lot healthier in many respects. And again, we can't say that that's going to mean, your cancer doesn't progress, and it's certainly not anyone's fault, if they're not able to think away their cancer. But there's certain strategies that we can employ once you've been diagnosed that are going to improve your chances of a favorable outcome. And we know that.
The production of this program is made possible thanks to the support of the following and viewers like you. So does awareness emerge, or do you cultivate awareness?
You cultivate awareness.
Okay.
So awareness is always present. Awareness is kind of that larger view. And I use a lot of metaphors. So if you think about the sky, there's always a blue sky beyond the clouds. And that's like your awareness. But sometimes the clouds of thought and emotion are so thick and dark, and there's rain, and you can't connect with that larger awareness, that larger nature, that nature of self that's always there. And so the practices are just techniques to help you reside more often in that field of awareness.
And then you talk about acceptance. I can imagine that somebody would hear that as saying, okay, I accept that I have cancer and that I'm going to die. But that's not the intention here.
No, not at all. Acceptance can be a tricky one, but acceptance is crucial. And the distinction we want to make is between things we can't control and where we do have a little agency, right? So accepting things that are beyond our control, even if we don't like them, right? It doesn't mean anyone likes being diagnosed with cancer, but if that's what you're dealing with and you're having difficult emotions, we need to be able to see that clearly Because if we deny it, push it away, try to pretend we're not feeling what we're feeling, we can never move through those emotions and resolve them and kind of come out the other side, right?
So by doing that, what then starts to happen from a physical and maybe a metaphysical perspective inside the body? Like, how do we start to then see that there actually is a better health outcome that changes in the patient themselves?
Yeah, so the physiological part of the mindfulness is all to do with decreasing arousal in the autonomic nervous system. And this is very well documented. So for example, if we're paying attention to our breath, what tends to happen is that the breath slows down. It decreases the fight or flight response. Your heart rate will go down, blood pressure goes down, and a whole host of impacts across our stress symptoms. So for example, the stress hormone cortisol is better regulated. We also see changes in our immune function. As I mentioned, there may be more activity in anti or inflammatory cytokines, that sort of thing. And so there is a real physiological reaction that happens in the body. And so even that, training people, and in fact, you don't do that on purpose. It just happens when you're paying attention in the present moment. And so your arousal level goes down in your body, and that also calms the mind because they're connected. And so when your mind is more calm, and I like to think of it like almost like a pressure cooker. So if you're high stress, high pressure all the time, it doesn't take much for you to fly off the handle, right? And you're snapping at somebody, or you're crying, or you're angry, whatever. And so by doing the practices, just paying attention, say to the breath or the body, it brings down the arousal level. So you're down here at a lower baseline, and you have more capacity to respond to the challenges from the environment, both physically and cognitively, because your mind is more focused and you're less reactive. And you know when you're stressed out, you can't think straight. Where are my keys? I can't make decisions. So it's just bringing down that whole level to a lower baseline. And that gives people capacity to respond more mindfully to the environmental challenges.
The production of this program is made possible thanks to the support of the following and viewers like you. So for somebody who, you're now introducing this idea to them, but they've had a hectic life and they've been all over the place. And now you're trying to say, I want you to try and change your perspective. Start to bring things a little more under control. How do you do that? How do you do that?
Yeah, and so you have to build a new habit, right? And I often talk about mindfulness as a skill. It's not just because you think it's a good idea that you should be more mindful and all of a sudden you are, or you've read a book about it. It's just like learning, piano or tennis or any other kind of skill, is that you have to practice it, right? It doesn't matter how many symphonies you listen to, you're not going to be a concert pianist unless you do your scales. And so the same is true for becoming more mindful in your day-to-day life. So the training program we take people through in our course, and it's adapted from a very standardized program called Mindfulness-Based Stress Reduction, 8 or 9 weeks, and people practice every single day. Different mindfulness practices. So we start out with some body awareness practices. We add in mindful movement. We'll do sitting meditations, walking meditations, a whole different range of practices, all designed to cultivate that capacity to be more mindful in your daily life. And so people do this for a period of 8 weeks. And after a couple of weeks, there's ups and downs, there's difficulties. We support people finding a time to do it, getting through it's not always fun, right? It doesn't always feel good. And that doesn't matter. You just have to do it. And so after a few weeks, it's become a bit of a habit and people start to see these changes arising. And then that's motivating to keep on with the practice.
I like in your book that you've got this wonderful way of saying, take a little bit of a child's mindset. I wonder what that is, or maybe you can describe the analogy that you use where you say, imagine you're eating a raisin for the first time.
Yeah, so we call that beginner's mind, and this idea of seeing things as if for the first time. And, in many ways, we're all born so mindful. Look at kids, right? And I remember when my kids were little, every spring, my son would proudly come up with this bouquet of bright yellow flowers, and he'd be like, oh, those are dandelions. That's a weed, right? But to him, it was a beautiful yellow flower. And if you look at it without all these preconceptions, it is a beautiful yellow flower that comes up in the spring. And, so the kids are really engaged in the moment. And every parent knows it's like, come on, we got to get to preschool. And the kid's looking at the ant on the driveway or something, right? And so they have this joy and this ability to see things. And for them, maybe it is the first time, but we can all take that attitude and approach mostly ourselves, because we label ourselves, like, oh, I can't meditate, I'm not that kind of person, or I'm an angry person, or I'm impatient. It's like, well, who told you that? Where did you come up with that idea? And maybe that was decades ago, in someone's opinion. I always hear the stories, an art teacher told me I wasn't artistic, right? We're all artistic. And so re-examining those ideas we have about ourselves and who we are and what our capacities are can be really valuable. And then the other piece, I think, is about connection with the world around us, right? It's so beautiful to walk down a path in fall and see the leaves fluttering and feel the breeze and hear the birds. But so often, if you go for a walk, maybe you're thinking about your grocery list, right? Or you're just powering along to get your exercise and you're just not engaged, right? And our life is so much richer when we're fully engaged in whatever we're doing.
So just to wrap up, the other benefits, I know we're focused on health, but the other benefit has to be the quality of relationships.
Oh, absolutely, yeah.
So it's an extraordinary discipline. And as you start to make it a part of your life, you basically are connecting, saying it becomes a habit. So you're not actually having to think about doing it. You just do it.
And I say to people sometimes, when they're struggling with their daily meditation practice, I said, well, think of it like mental floss, right? Most of you are taking care of your teeth, because it's part of your dental health. Well, this is part of your mental health, right? So doing your practice every day is this sort of self-care routine that you can incorporate with all your other self-care routines that you're already doing. And it's just as important, right, to maintain that capacity to be mindful.
Thank you for giving us some insight into your work, your book, and of course the extraordinary benefits that this brings to people who are facing challenges in their life.
Yeah, it's been my pleasure. I always enjoy talking about these ideas.